Hi everybody. So I wanted to do a puberty series. I'm going to start with girls. So I wanted to just talk to moms and daughters about what to expect in puberty. It's sometimes taboo. I know they teach this in school, but I think it's easier to talk about it. Sometimes just watching a video, sometimes sitting down and making sure you're talking one-on-one with your daughter, because there's so many questions that come up, right? So first of all, puberty. For girls, we have both our breast development and our hair development. So we talk about teal arc, which is the breast development, and hair development. So like under our arms, in our private area. And along with that hair development comes the development of body odor and acne and things like that. We also have growing taller and then eventually getting our periods. So obesity in women and girls does play into having an earlier start to puberty. So if girls are overweight, that adipose tissue or that fat tissue does store estrogen and increase your chances of developing earlier. That's why we sometimes see girls, younger girls who have breast tissue, etc. That does not influence boys in the same way. In general, you do have like about 50 to 75% chance of genetically following one of your parents or their families and their sort of pubertal development. So when did mom get her period, or when did dad's sister get her period, so that we could kind of know what to expect from you. In general, puberty takes about 2.5 years from start to finish, right? The very start of it is the first development of breast buds. And those are just hard little knots under the nipple, okay? They can be sore, they can be painful, and don't try to push on them or touch them. That'll just make it feel worse, okay? So that is the first sign of puberty. We call it teal arc, so breast development. From teal arc, your breasts will continue to grow. So from just the breast bud, the breast will start to get bigger. Then we start to see a growth acceleration in your height. So that is actually pretty exciting. So you will start to get height. And this is different from boys because height development is one of their last pubertal developments. So this is why we see in girls those couple of years where the girls in school are taller than the boys, because for girls, height growth is earlier in puberty than for boys. So girls are growing fast earlier than the boys do. So it's the second thing we see in puberty is the growth height acceleration. So their peak height is reached somewhere around 6 to 12 months before their period. Okay, so there's kind of like 5 stages to puberty. Stage 1 is breast development, and then stage 2 we're seeing height development. And they're wrapping up their peak height around stage 3. That doesn't mean they're stopping growing. It means their peak height is done around stage 3, okay? There is a difference in ethnicity and race in how early people start. The earliest is the Black community, and they are somewhere around, 8.8 years old. The white community is around 9.6 and 9.5 years old when breast development starts, okay? And from that point, it's 2.5 years typically. Not everyone follows the same thing. And sometimes it's not breast buds first. Sometimes it's pubic hair first. It's about, a quarter of the population can start with pubic hair first. But in general, this is the way it happens. So breast buds, height, then we start with what we call adrenarche, which is the development of underarm hair, pubic hair, body odor, okay? Probably already starting to use deodorant at this point, but if you haven't, that's the time to start to use it, okay? You're starting to get finer hairs first, okay? So just like straight hairs. And as puberty progresses, they're going to start turning curlier, and then they're going to, from in your pubic area, they're going to start spreading out. So from just on the pubic bone to further out into your inner thighs, right? During this time, in the first year or so, it is normal to have vaginal discharge, okay? This is not your period, but it is your body starting to get used to becoming a woman. So it can be thin and clear, it can be thin and white. It is not a yeast infection. This is normal, okay? Women have normal discharge. They have a little bit of discharge on a regular basis, okay? I wouldn't wear a liner all the time, but you can, if it makes you uncomfortable, just make sure you're not doing it and being what we call occlusive, like, because then that can throw the pH off or the imbalance off in your vaginal area, okay? So stage 1, breast development, then peak height, then we're getting body odor and hair development. Then in stage 4, that hair development is spreading out to inner thigh area. We're starting to get some acne. And we need to watch that this is the time period where we're starting to see some emotional changes as well, because all of these hormones in our bodies, it's not just estrogen at this point. Now we're talking about androgens. Women also get testosterone. It's a small amount, but it's there. It just makes us, feel a little bit moody at times. And then finally, around 2.5 years later, our periods come. When they come, it looks brownish. It does not look bright red the way that we think it's going to look. It looks like old blood, and it's just a little bit. For Black women, it's going to be around 11.5 years old versus 12.5 for white women. So expect it a little bit earlier in the Black community than the white community. Moms, help prepare your girls, okay? Have them going to school with a little zipper pouch of liners, pads. They're not going to need heavy pads at first, okay? So thin ones, show them how to put them on. Show them how to wrap their underwear in toilet paper in case they go to the bathroom without that little pouch, because that's an easy go-to thing to make sure that they're covered if they get their period in the bathroom and they don't know what to do. It's very simple. You just wrap a bunch of toilet paper around your underwear, you're protected, and then the next time you're able to go to the bathroom, you bring your little pouch with you, okay? I think every adult woman knows how to do that. As you get older, you can learn how to use tampons. You're going to use a very small one at first, and then as you get older or your flow gets heavier, you can use, a larger size. Some people have to use, both of them at the same time. Important things, you should not be going through a pad more than once every hour. That's too heavy of a period. Cramps are normal, and cramps can start prior to your period. So you can have cramps 2 or 3 days prior to the start of your period. The best thing to do about that is to take some ibuprofen or Aleve to decrease the cramping. Once you get your period, moms and girls, you can still grow up to 2 inches. So don't freak out that you're done growing, okay? Second thing, once you get your period, it can be up to 2 years before your period is regular. So don't freak out that you're not getting your period every 28 days. It takes 2 years to start ovulating, and ovulation is what keeps our periods regular. It's what makes us have our period every 28 days. But that, again, takes up to 2 years to start happening. So you might get a period and then 6 months goes by and you don't get anything. So don't worry if it's not happening on that regular basis for a while. That's why it's important to have something with you and be prepared, but also know how to do something in case of emergency. I also know they make those cool underwear, that you can wear just in case to protect yourself, especially in sports and things like that, okay? Those are the highlights. I hope this helps. Let me know if you have any questions, girls.